three things. We want to share with you the ICHOM strategy for the next decade. We want to say thank you and maybe repeat some of what Suzanne has done, but it can be repeated many times. And finally, share with you some of the logic behind the agenda that you will be following today and tomorrow.
One of the reasons that we're here 10 years later is that the mission stands, and that is to unlock the potential of value-based healthcare by defining common standard sets and to drive the adoption across the healthcare system. And that means that we see the value sets as the foundation for what we do. But they're not enough. We also need to drive adoption in order to connect and compare healthcare outcomes across different organizations. And only in that way we can achieve what's the ultimate goal, namely a learning and improvement environment all over healthcare in order to meet the challenges of the future.
So the foundational idea of ICHOM was that healthcare has a number of challenges, and Elizabeth and Michael describe many of those in their book, and they have only gotten worse. We have the challenges of inefficiency, we have the challenges of wasted resources, we have the challenges of disenfranchised doctors and nurses in the healthcare system. And our view was that there is one focus that will allow us to change this situation, and that is the measurement of outcomes. If you measure outcomes and share the results, you will know which treatments are helping patients and which are not. Where do we waste money doing things that don't help patients? We should stop doing them. We will know that. We will have information and data to improve guidelines, to know how to organize care in a better way. And we will also, very importantly, be able to align the purpose that doctors and nurses and other staff in healthcare, the purpose that brought them into the profession, with a definition of performance. Performance cannot be to do 6 surgeries instead of 5. It has to be to deliver better outcomes to patients. That's the alignment of professional purpose and performance. And we believe that's what the lever, Archimedes' lever to change the healthcare world, is the measurement of outcomes. And so, this is moved around a bit with the new computer.
Compare.
That's okay. So if we move back to the triangle that Martin shared, which is the 3 elements of our mission. Where we started was to develop the standard sets, as Caleb Caleb described so well. So we've developed 44 standard sets. 36 of the first 36 have all been published in peer-reviewed journals, which I think is a great testimony to the profession at large, scientists and clinicians having recognized the methodology. And in addition, what we have done over the past couple of years is to harmonize the data sets. They were originally 44 silos. We've brought them together. So if you measure X for asthma patients, schizophrenics, and something else, we should measure it exactly the same way. And so that harmonization has taken place. In addition, we have sought to bring people together to connect and compare. So we organized the conferences like this one. We had also, as you know, ICHOM Connect, our internet platform that brings people together virtually to exchange learnings. And that we can do that much better in the future, but it's the starting point of allowing exchange globally of experience. And then finally, we've done some benchmarking pilots where hospitals who have measured standard sets, we've looked at the data and tried to compare it. And it's fair to say that the benchmarking has actually been quite challenging. We've learned an enormous amount, and you will hear some about that during the coming days. I believe we will be able to move in the next wave into something which will be much more impactful. And the next decade, which Martin will share about, is going from laying the foundation to having impact on healthcare.
So we will try and support the creation of learning collaboratives where cross-organization learning can take place, because we realize the ability to collaborate is probably the key to go forward. learning collaboratives is one thing. Another thing is that you can step it up even further and do real studies with these types of data for real-world evidence and that sort of studies. We want to support regional and national use of measures and to provide turnkey solutions in order to jumpstart these types of collaborations. One such turnkey solution will be demonstrated at 1:40 on Thursday in the Statler Room. And we have also learned during these years that it's complicated to measure value-based healthcare. It's complicated, and it's a measurement burden. So we suggest that we move over also to create core standard sets, a minimized set of measures that you need to measure in order to provide data for comparability that are common between organizations. Then you can have more measures if you want to understand more things about your local organization. We will continue to do new standard sets, but we will also version control the ones we have with an annual upgrade in order to make sure that we stay learning from the top of this pyramid that actually inform us on how to further adjust these standard sets.
So as we move from what we did the first decade to lay the foundation to the second decade, now be more and more focused on trying to make it easy for providers around the world to compare with each other, to learn from each other, and therefore have impact. That's a quite significant change in what we do, but ultimately addresses that critical part of our mission. And so to symbolize that shift from the first decade to the second, we are intending to actually change our logo. Jens will laugh at this because the color and et cetera change, but we think it's an important symbol of the next decade that we make this shift. And one of the things that's going to be very important, if you want to bring international networks of providers that can collaborate and learn from each other, is not only that you measure the same way, but that the technical standards also makes it easy to connect and to share information. And therefore, ICHOM will also take on a role of certification to make sure that the measurements are done the right way and that the technical platforms used are aligned with each other. ICHOM will never own any data. We are in the business of laying pipe, of putting oil to make it go easier, or the shovels to make it easier for people to impact healthcare. We are doing a set of other changes as well as we move into the second decade. One is to grow the board. And I'm happy to announce the first member we added to the board just a couple of weeks ago, which is Mary Witkowski. Mary has worked for 10 years in Michael's group, has been the person who's led the work on value-based payment models in his team, and has also worked extensively both on payer or provider evaluation efforts, as well as in the area of fundraising. So she brings important capabilities to the team now that Michael is engaging, we're able to engage much less with our work. But we're adding additional members to the team. We are in discussions with patient advocates. We want to add a strong patient advocate to the group. We want to add somebody with fundraising expertise and somebody with government and policy and regulatory expertise. We are also adding a couple of advisory groups to the board, not to the board, but to the organization, seeking leading experts in some of the topics most critical to us strategically to support the boards, but also the leadership team's decision-making. And finally, we are, of course, also seeking Suzanne's replacement, and I know that's not going to be easy, but we're working hard to find Suzanne's successor. So whether you in the audience know of somebody you think would be a rock star in our board, or somebody you think should be a great candidate to be the next president, please let us know. Second part of our presentation is the thank yous. And as Suzanne did, we want to thank the working groups, the 1,000+ clinicians and patients who have spent their time and shared their expertise to make the standard sets possible. Over 60 nations, truly a global effort, and the only one of its kind internationally. It's something we're very proud of. But the working group members is the backbone of what ICHOM has achieved. Nothing would have happened without their time and commitment. We also want to thank the alumni. You will be seeing many of the names and faces, often quite young individuals, super gifted and dedicated to the purpose, what we stand for as an organization. So we want to thank them as well. And finally, we want to thank the sponsors. And in this case, we have many. You've seen others on a slide, but here are a couple. And these are sponsors who have actually helped us with the transition from laying the foundation to the one of having impact. And it's particularly been around the digitalization of our standard sets. Initially, the Dutch ministry invested heavily in helping us do the harmonization together with Intermountain, and particularly Stan Huff, who's with us today, helped us with the term bank and the harmonization of the metrics. More recently, we've had support from Medtronic, Philips, and BCG, who have given us resources and expertise on mapping our standard sets onto different standards, SNOMED and LOINC, but also communication standards such as FHIR. And this is really critical to make it easy to take our standard sets and insert it into software, electronic medical records, etc. And we have one additional group we want to thank, and that is Movember. They've been mentioned before. You have small things on your tables to, if you want to contribute to them. And if you see some of your colleagues here being suspiciously unshaven this morning, maybe they've decided it's month of November, I'm going to help Movember. That's the explanation. So we're indebted to them, but also to many, many other sponsors.
Sometimes
that's really changed.
That's really interesting. Okay, this is to illustrate that healthcare is a complex system. And to change a complex system, you need a driving force that is sustainable and lasts a long time and is coordinated between the stakeholders. In our mind, the ability to measure outcomes the same way in different organizations is one of those ways where we can provide the same basis for the driving of change between the different stakeholders in healthcare.
So the common goal for all, whether you are a pharma company, a payer provider, should be patient value. Outcomes that matter to patients should be the goal for all. But there are three other important levers if you want to change a complex system. The common goal is the first. The second one is to have access to data, have access to information. Are we doing well or not? How do we compare to others? Who should I learn from? Be able to follow a patient along the patient journey. Data and data standards is critical in order to allow the system to learn how to move towards the goal of better, in our case, better outcomes for patients. The second, or the third lever is resources and incentives. In healthcare, when you talk about resources, it's to a large extent the providers. How do we make the providers, allow them to be flexible enough to really change so that they deliver more value to patients, better outcomes to patients? Make it easy to treat people at home when they can be treated at home instead of in an intensive care unit. Make that easy, make it rational. When it comes to incentives in healthcare, it's typically payment models. Fee for service, you pay for volume. The more stuff you do, the more you get paid. That needs to change. We should have incentives, payment models that encourage high-value care. It should make sense to have treatment at home instead of in the intensive care unit, if you can do it. And the fourth lever to change a complex system is policy, government, and regulation. We need to have rules, regulation, that makes it easy to deliver high-value care. Now, these four levers are represented in the program. This is the fundamental logic of the agenda for today and tomorrow. The first one on outcomes at the center, outcomes measurement. Elizabeth Theisberg will run a session later today on how outcomes measurement is critical for equity. We shouldn't talk about equal access, we should talk about equal outcomes, and then we need to measure it. Jamie Haywood would lead a session on digital, on IT, the lever of using data to drive high-value care. And we have some of the world-leading experts in digital health who will speak at that session. We have one session that Martin is leading on delivery organizations, change management of how to change a provider organization. Mary Witkowski will lead the session on payments, value-based payments, tomorrow together with the World Economic Forum. And finally, after this session, and we should soon be there because I have a red zero in front of me, is on the role of policymakers.
And with this, we realize we're 500 people here. So on behalf of the STAR ICHOM team, the board, we wish you welcome to Boston 2022. Meet, be inspired, and make change happen. Very welcome.
Thank you.